his opening remarks. Dr. Tedros, you have the floor.
Shukran Fadila. Good morning, good afternoon, and good evening. The pandemic has reminded all of us of the heroic work that health workers do every single day. Health workers account for an estimated 3% of the world's population, but account for 14% of all infections with COVID-19. One of WHO's primary concerns has been to ensure health workers have access to personal protective equipment. We also advise that health workers should clean their hands regularly with an alcohol-based hand rub or wash with soap and water. And yet, new data from WHO and UNICEF show that 1 in 4 health facilities globally lack basic water services. In the world's 47 least developed countries, half of all health facilities have no clean water on site. This puts health workers and patients at risk from infections of all kinds, makes childbirth much less safe, and drives antimicrobial resistance. Addressing this gap is an urgent priority for WHO and UNICEF, and must be for the rest of the world. Preliminary estimates show that making sure all healthcare facilities in the 47 least developed countries have basic water, sanitation, hygiene, waste management, cleaning services will cost an additional $3.6 billion between 2021 and 2030. And we know that for every dollar invested in hand hygiene alone, there is a return of $15. In other words, investing in water, sanitation, and hygiene is not just the right thing to do, it's the smart thing to do. While the direct health impacts of the pandemic on young people have been generally less severe, youth are disproportionately affected by the long-lasting consequences of the pandemic. Disruptions to education, economic uncertainty, loss or lack of employment opportunities, impacts on physical and mental health, and trauma from domestic violence, to name a few. More than 1 billion students in almost every country have been impacted by school closures, and 1 in 6 young people worldwide have lost their jobs during the pandemic. Throughout the pandemic, WHO has been working with young people and many partners, including UNICEF and UNESCO, in several ways. We have supported and amplified youth-led initiatives on combating misinformation and mental health. We have engaged young people in co-creating communication materials for young people about reducing the risk of COVID-19 transmission. We supported the youth-led COVID-19 youth survey to assess attitudes and awareness of young people about COVID-19. And we will soon be publishing the results of a global survey about how young people look for and use COVID-19 information online. 2 weeks ago, we launched the WHO Youth Council to provide advice on key health and development issues affecting young people. Today, we're delighted to be taking part in the launch of the Global Youth Mobilization for Generation Disrupted, a new worldwide movement to support young people and involve them in the response to the COVID-19 pandemic. This new initiative is being led by what's known as the Big Six youth organizations: the World Organization of the Scout Movement, the World Association of Girl Guides and Girl Scouts, the Young Men's Christian Association, the World Young Women's Christian Association, the International Federation of Red Cross and Red Crescent Societies, and the Duke of Edinburgh International Award. Together, these organizations and networks actively involve more than 250 million young people. through the new global youth mobilization. The big 6 youth organizations, WHO and the UN Foundation, will engage young people around the world in the design of community initiatives to turn around the impact of the pandemic. And we hope that it will become a platform for supporting progress towards other health goals, including universal health coverage. The voice of the youth for Health for All is very crucial. In early 2021, the movement will issue a call for proposals inviting youth groups around the world to develop youth-led solutions to COVID-19 and an accelerator program to scale up existing response efforts. $5 million has been allocated to this initiative from the WHO COVID-19 Solidarity Response Fund, powered by the UN Foundation. The Global Youth Mobilization will also feature the convening of a Global Youth Summit in April 2021. Today, I'm delighted to be joined by 4 representatives from the movement's project board. Ahmed Al-Hendawi, Secretary General of the World Organization of the Scout Movement. Tarindra Aruma Peruma, an emerging leader and International Council member of the Duke of Edinburgh's International Award. Michelle Shiji Chiu, Youth Commission member of the International Federation of Red Cross and Red Crescent Societies. And Casey Harden, General Secretary of the World Young Women's Christian Association. Mr. Al-Hendawi, before I give you the floor, I understand that today marks the 100th anniversary of the World Scout Bureau. So I would like to wish you a very happy birthday and congratulate you for the huge impact you have had on young people over the past 100 years. Thank you, and you have the floor.
Thank you very much. Thank you, Director General, Dr. Tadros. Thank you for your leadership and for your very warm words and wishes to the Scout movement. And thank you very much for really the exemplary leadership you have extended in this response, and for the incredible team that we have seen at the World Health Organization as steering the response to COVID. Today, we are delighted to join forces with the World Health Organization. We're a group of some of the leading youth-serving and youth-led youth movements that are very concerned today about the societal and health impact of COVID-19. The COVID-19 challenge, as you rightly said, Director General, has paralyzed youth development and the ability of many young people to simply exercise their youth and to access opportunities to education or employment. And as you rightly said, we all know that the long-lasting impact of COVID-19 will be felt most by them. So these gaps need to be addressed. And we believe by joining forces and working together, we need to prioritize investments in young people. We believe that young people are opportunities in the response. They are not liabilities when we are combating COVID-19. And we need to engage with them, and we need to see the value of this engagement by recognizing the realities. Young people are calling for building back better, and they are calling for taking the lessons from all the things that went off a track before the pandemic. And I think it was a wake-up call for the world to think back of this youthful world that we have, with half of the world's population under the age of 25. So today, this global mobilization is bringing together leading youth organizations from serving over 250 million young people around the world. But it's not only limited to the big 6 youth organizations, the IFRC, the Scout Movement, WAGS, and together with the Duke of Edinburgh Award and our colleagues on the YMCA and YWCA. We also would like to engage more youth organizations, the smaller youth organizations, the youth organizations and youth groups who otherwise would not be able to access these opportunities. That's why we would like to salute the World Health Organization and UN Foundation for reaching out to all of us, and for, in fact, for challenging us to come together and for coming up with solutions that would help in your response, not only to do and to deal with the health side of the pandemic, but also the societal impact of COVID-19. So this is an exciting moment indeed for us to join forces in investing and scaling up global youth-led response to the recovery efforts to COVID-19. Our mobilization is offering some unique solutions. As someone who has worked in youth development for years, we have been always calling for more funding and youth-friendly funding to support the local initiatives. So what concretely we will be doing, utilizing a fund of over $5 million and this global partnerships and community of supporters to the Global Solidarity Response Fund. What we will be doing is to accelerate some of these responses and solutions created by young people. We'll be investing, injecting more resources in youth-led organizations who, as I said, otherwise would not have access to these funding instruments. We will be scaling up existing response efforts. And as you rightly said, Dr. Tadros, we will be coming together to talk about how to build back better in a global youth summit in 2021 that brings young people and youth organizations across the world. So we're very excited about this mobilization. It's an exemplary leadership that you have shown, and not reaching out only for, say, organizations who have traditionally engaged with the World Health Organization, but also other organizations who can be instrumental in building back better. Thank you very much.
Thank you so much indeed. And I fully agree that this is not just about the big six, but involving all youth groups to lead the movement. So thank you so much for that, Mr. El-Handawi. And now, Ms. Arumpa Peruma, and thank you for joining us today, and thank you for everything that the Duke of Edinburgh scheme does to engage and empower young people. You have the floor.
Thank you, Dr. Tedros. We all know that this year has been incredibly difficult for all generations. It doesn't necessarily have to be young people, but every generation is touched by this pandemic. And despite the fact that COVID-19 impacts older generations more directly, we believe that young people have the most to lose. And definitely there will be communities are facing and which they are facing as a result of COVID-19. And definitely it is crucial to recognize and celebrate these actions which are being come up as a youth-led team. And also we aim to bring hope, and we can hope that we as a mobilization program and young people behind the force behind it will be a driving force for the change we want to see in all communities across the world, and to use all the diverse skill sets of young people to open up new avenues and opportunities. Also, we know that young people worldwide are already doing a lot of great work to alleviate negative impacts. And definitely this is an opportunity we can use to recognize, to celebrate, and to invest in all their wonderful further efforts. So thank you.
Thank you so much indeed, and my greetings to Sri Lanka. Now, Ms. Chew, thank you for joining us today, and thank you all young people who work with the International Federation of the Red Cross all over the world, and you have the floor.
Thank you, Dr. Tedros. Honored to have the opportunity to speak here on behalf of young people today. Education has been particularly hard hit during the pandemic. As you have mentioned earlier as well, Dr. Tedros, worldwide, more than 1 billion students in nearly every country have experienced school closures, depriving them on critical education and learning opportunities. And young people are missing out on this, right? During the pandemic, young people are actually left stranded and lost without means to, obtain education. Antonio Guterres, Secretary General of the United Nations, has called this the largest disruption to education in history. While many young people are starting to get back to school, rolling lockdowns means that the COVID-19 risks to education are actually not over for us. The quality of or the access to education should not be compromised during the pandemic. Young people should not have to sacrifice educational opportunities in exchange for our livelihoods and health. Youth should still be able to learn and gain knowledge through various means, and this includes through informal and non-formal education. Therefore, this mobilization effort We actually help to provide young people with the resources for both personal and professional growth, while empowering us to take the initiative and propose our own solutions. Our generation is actually very aware of the social, economic, and environmental challenges facing us, our communities, and the planet. We are not silent, and we are not standing idly by. We want to help, and we are capable to help. We're really not super spreaders or troublemakers, but we are part of the solution in mobilizing and volunteering to see the change that we want in our communities. And this is why, as young people, we are really excited about this global youth mobilization, because it provides us with the platform to share our ideas, experiences, and solutions to build the post-pandemic future that we envision and want to live in. Young people want to build back better.
Thank you. Thank you so much, Michelle. I fully agree, and we hope the global youth mobilization will bring significant progress. And now, Ms. Harden, thank you to you and the more than 130,000 volunteers who work with the YWCA movement all over the world, and you have the floor.
Thank you very much. As the world